This is Lynn Fraser with the Kilby Center for Recovery. I'm really pleased to have Dr. Gabor Maté here. In this Radical Recovery Summit that we're doing, hosted by the Kilby Center, one of the things that's really clear from the interviews we're doing is that trauma is at the root of addiction. And Dr. Maté is a specialist in this area of trauma and of addiction. So it makes it really wonderful that you could be here to talk to us. So thank you.
Pleasure to be here. Thank you. So my name is Gabor Maté. I'm a medical doctor in Vancouver, British Columbia. Retired from clinical practice a few years ago. I was 32 years in medical practice, 20 of them in family practice and in palliative care, and then 12 years in addiction work in Vancouver's downtown east side, which is notorious as North America's probably most concentrated area of drug use of all kinds. The population I worked with was dependent on heroin, on cocaine, on crystal meth, drugs of all kinds, virtually all of them on cannabis, on nicotine as well, many on alcohol. And we'll talk about who they are and why they're addicted later on. My interests have always been in the impact of early life, developmental environment on health and illness later on in life. I've written 4 books. The one on addiction is entitled In the Realm of Hungry Ghosts, Close Encounters with Addiction. And other books I've written on the mind-body unity in health and illness. It's called When the Body Says No. I've written books on child development. I'm interested in ADHD after I was diagnosed with it myself. We'll maybe talk about it in this interview. I see a huge link between ADHD and addictions. And what those links are, we could also discuss later. But those have been my areas of interest. Right now, I travel a lot, teach a lot about addictions internationally in North America, particularly, and on the other issues that I've written about. So basically, I'm a physician who's learned that to understand the world and health and illness, I have to go way beyond the narrow confines of the mainstream medical perspective. And that's very much true in addictions.
It strikes me that you probably aren't always a welcome voice in mainstream medical and addiction treatment, that some of your the root ideas and what you put forward around compassion and war on drugs and why people are addicted isn't something that's been commonly understood by anybody. Is that changing for you now? See a difference in that?
Well, within the last year, I've spoken at for the Massachusetts Medical Society, the group that publishes the New England Journal of Medicine, for example. I've been invited to a number of colleges, universities. I've spoken to psychiatric departments, but on the whole, there's tremendous resistance in the medical profession to any perspective that is holistic. And by holistic, I mean a perspective that's not strictly biological. So that the medical worldview on illness, whether it's cancer, autoimmune disorders, rheumatoid arthritis, multiple sclerosis, or whether it's addiction or anxiety or depression, is that these are fundamentally biologically rooted diseases, and the answers as to what causes them and how to treat them are going to be found in biology, in genetics, but in other words, in a separation from the individual's life and the conditions that afflict that individual. Whereas the holistic perspective says, if a condition arises in the person, that's the expression of a life. That's an expression of life experience. That's an outcome of particular events in that person's life and how that person relates to those events. So that that perspective is difficult for physicians because we're trained in such a narrowly biological way. So any resistance is not to me personally, it's more to this broader perspective. And many physicians find themselves frustrated by that limitation, by the way. And so the other problem is I do talk about trauma. And trauma is an uncomfortable subject. trauma is an uncomfortable subject for teachers to confront, for parents to confront, for physicians, for doctors to confront, for the legal system to confront. And yet it's a basic a basic fact of life for a lot of people, and a basic driver of a lot of human suffering and dysfunction. And it requires a willingness to look at ourselves, both as individuals and also as a culture, and as professionals. So a holistic perspective that looks at the person's entire existence, and particularly with an attention to trauma, is just not comfortable for a lot of people. That's just how it is. I'm finding, however, that there's a lot more interest and a lot more opening than there was a few years ago even. I have nothing to complain about. I'd like to see it happen faster and on a deeper level, but it's not entirely hopeless either.
I've been very much affected by your teaching on compassion and childhood trauma and developmental trauma, and I use that a lot in the work that I do with people as well. But personally, I've learned a lot from that, and it never occurred to me. I didn't really know anything about it until I think it was one of your TED Talks several years ago. And people I talk to have the same experience. They're like, "What? I had no idea that that's how it worked."
Can I ask you a question?
Mm-hmm.
So how long have you been doing this addiction work?
I've been working on this for about 5 years with Scott Killaby.
Okay.
And before that, I've been working on it in other ways. I teach meditation and do different things. The piece that I didn't know, I developed PTSD in 2005 after I was assaulted. And I didn't know anything about developmental trauma and how that fed into it. So I did a lot of healing from the PTSD, but it wasn't until about 5 years ago that I started to understand developmental trauma and then start to work with that things started to actually heal.
In other words, what I'm guessing here is that the trauma you experienced in 2005 wasn't just an event in itself. It was, I'm sure, a difficult one, whatever happened, but it also triggered dynamics that you may have carried all your life that related to your childhood that you weren't aware of before. Is that what happened?
Right. In my case, it was emotional neglect that was the key that led to a lot of things that happened in my teen years, and stigma and shame. And I just didn't ever think of that as trauma. And once I understood how it worked, it made all the difference.
Yeah, the word trauma is a difficult one because when we say trauma, people always imagine some horrific event, such as a rape or significant physical or emotional abuse, a tsunami, the death of loved ones. These are potentially traumatic events, but people think of trauma, they think, well, nothing like that ever happened to me. I couldn't have been traumatized. So, well, we actually need either a new word instead of trauma, so people are not thrown off, or we need to have a deeper understanding of what trauma actually is, which is not these events, but something deeper that happens inside of us. And it doesn't require such events to evoke it. So either we get a deeper understanding of trauma, or we find a different way of talking about it.
So the work that you do with that you were doing with addiction on the Lower East Side, can you talk about the trauma piece there? I've heard you talk about that, and it makes so much sense that people that are why the pain, not why the addiction, but why the pain. Can you talk about that a bit?
Sure. Well, what I begin with is this: that if you ask anybody, well, let's try it with you. I'll give you a definition of addiction. Okay, an addiction it's a complex psychological, physiological process that manifests in any behavior that a person craves because it gives temporary pleasure or relief, but causes negative consequences in the long term, and the individual doesn't give it up despite the negative consequences. So it's craving pleasure or relief in the short term, negative consequence in the long term, inability or reluctance to give it up. Okay, that's what an addiction is. So I'm not going to ask you what, but by that definition, have you had one or more addictive patterns in your life at any time?
Oh, definitely. Yeah, and a
Okay.
lot of that happened when I was 12, and there was drugs and alcohol involved, which eventually fell away. But the food addiction has been up and down.
Okay, so here's what I ask you then. Let's take the food addiction then.
Mhm.
Uh, Not what's wrong with it, which we all know, but what does it do for you in the short term? What do you get from it that you like?
In the short term, it's comfort and it's safety.
Okay, which means that there's an absence of comfort and an absence of safety.
Hmm.
The addiction is not your primary problem. Your addiction is an attempt to solve the problem of lack of safety and lack of comfort.
Hmm.
Talk about addiction as a primary disease is simply to put the cart before the horse. The horse that's pulling this is the discomfort that you experience in your life and the lack of safety you experience in your life. And to understand that, you have to look at not at your biology, but at your life. What happened, what happened to create that lack of safety? What happened to create that discomfort with yourself and with the present moment that you have to escape from? So if you understand addiction not as the primary problem, but as an attempt to solve a problem, now then we're guided to an exploration of that person's life. And that person's life happens in the context of a family of origin. And the family of origin happens in the context of a multi-generational family history and in the context of a culture in a certain society. In short, to understand one person's addiction, you have to look at generations of people and the society and the culture and the community where they live. And if you look back, if you come back to the downtown east side of Vancouver, uh, the First Nations people, the Aboriginal people of Canada, make up 4% of the Canadian population. They make up 30% of our jail population, 30% of the population of Vancouver's downtown east side, just as an example. And if you want to know why, you have to look at what happened multi-generationally, which is historical trauma, social cultural trauma, and then personal trauma that's repeated generation from generation. All of those people have been abused in their families of origin, which began with colonialism and which began with the destruction of their culture and their way of life and their restriction to reservations, and then the abduction of their children into residential schools where they were tortured, killed, and abused. And then you wonder why the Indians are so drunk, because they're in so much pain. And so to generalize that, in the downtown east side in 12 years of work, I did not have a single female patient who had not been sexually abused. And First Nations, not First Nations, didn't matter. The men have been all traumatized, abused, sometimes sexually, sometimes in other ways, neglected, abandoned over and over and again. That was their history. What struck me when I began to write my book on addiction, or at least when I got deep into it, I was just going to write a book about my experiences working as a physician with that population. It was not going to be a book on addiction in general. What astonished me is that there's virtually no volumes on addiction as a trauma-based phenomena. Virtually none. I found out about one later that kind of touched on it. But this is the case despite the fact that the research literature has got plenty of evidence on the connection between trauma and addiction on the physical, neurobiological, neurochemical, emotional, psychological, spiritual level. Lots of literature on it, but nobody had put it together. And that's what struck me. And that's why I wrote the book I ended up writing, which was much more than about Vancouver. It's downtown east side. It was about addiction in general. And addiction, whether it shows up in respectable forms in a guy like me who's got a good middle class job and respectability, or if it shows up in a workaholic business executive, or a power hungry politician, or a downtrodden minority person, the dynamics are the same. And it's always an attempt to resolve, to get away from, not to resolve actually, but to temporarily escape from some deep pain. And hence my primary question, not why the addiction, why the pain? And why the pain? Well, that you have to look at people's lives.
And people are often resistant to doing that.
They are resistant. Sometimes people are resistant to look at their own pain. Incidentally, that's what I think is one of the sources of resistance in the professional world, is that to really look at their client's pain, people have to look at their own. They're just not comfortable doing that. And so let's not talk about that stuff. So we can go to rehab facilities and addiction treatment programs for years. And nobody ever talks about what happened to them in terms of their actual trauma. I wonder how come we're not succeeding with our programs. But but sometimes people will. I heard a very well-known spiritual teacher assert recently that they had not been traumatized as a child. And I happen to know that they had been. They had written about what happened to them. They just didn't see it as trauma. In other words, what happened was that these events occurred, but how does the child deal with such events happening? Well, one way to deal with it, if you can't talk about it with your parents, the only way you can deal with it is to suppress the emotions surrounding the event. Then you think you had a perfectly happy childhood because you don't remember feeling bad. But you didn't feel bad because you couldn't allow yourself to feel bad, because to feel bad would have brought you into conflict with your environment. Sometimes when I give my talks, people will say, well, I was addicted and I had a perfectly happy childhood. And usually it takes about a 3-minute conversation to show somebody, well, did you really? Not that you're lying, not that you're dishonest, not that you're pretending anything deliberately, but that actually the way you survived your childhood was to disconnect from how you actually felt. The problem is that these feelings will show up in your adult life, and you don't want to know why. I want to look at somebody's childhood. I just need to look at see how they interact with their spouse when they're upset. That was their childhood. They just don't see the connection.
What is it that opens that up for people in your experience? It takes a lot of courage to do this.
Well, yeah. And it takes a lot of courage. Except when we feel safe. When we feel absolutely safe, we don't have to have courage. We can just be there the way we are. So it takes a lot of courage, or it takes a lot of safety. And so I think when it comes to treatment, that's just a key word. Now, I'm always very influenced by the most recent works that I've read or studied. And most recently, I've been studying the work of Dr. Stephen Porges, a theorist of the polyvagal theory. And without going into a whole lot of details, what it comes down to is that when people are safe, neurophysiologically, they're in a different state than when they're not safe. And from the therapeutic point of view, from the point of view of this discussion, for people to really open to their pain and their hurt, they have to feel very safe that it's okay to be that way and that they'll be taken care of. They won't be punished, they won't be judged, they won't be rejected, they'll be actually heard. Now, that means that the professional has to be very open and make themselves very safe for the client. If they don't, if I'm going to be this white-coated professional with a very narrowly drawn set of boundaries and it's all about me, I'm the expert and I'm going to fix you and all that, well, you're not going to feel very safe with me. And then the things that are most important will never get talked about.
And shame and stigma are such an important part of addiction.
Yes. So first of all, anybody who's addicted has shame in them already. And the shame was in them before they were addicted. So now we have to understand what is shame about. We tend to think that shame is about bad things that we've done, but actually shame is really about disconnection. When we lose connection with others, we feel shame. So does the 9-month-old infant or the 1-year-old child. So the shame that we carry always goes back to an early disconnection, which is not necessarily anything our parents deliberately did. But if they were emotionally were not present, if they were distracted, depressed, distressed, too busy, emotionally not attuned, that child's going to experience shame. And they're going to think there's something wrong with them. Now, that'll drive addiction because we'll do anything to escape that feeling of shame. Trouble is, then the world judges you for being addicted and tells you you're a bad person and you're weak and you're morally flawed, which then what does that do? It increases the shame. It increases the pain. What does that do? It drives the addiction even more. So it's like a self-reinforcing loop. Shame, addiction, shame, more addiction, more shame. You know, and not to mention the fact that, of course, to speak of my own addictive patterns, when I have been behaving in addictive ways, which has been very often in my life, I behave in ways that are shame-inducing. I lie, I cheat, I deny, I hide, subterfuge. We all know the games that the addicted mind plays. So the people that you're closest to, your spouse and your friends, you're pretending, you're lying, you're denying, you know. Well, that increases more, that causes more shame. That's legitimate shame. Unless you understand that before you did these things deliberately, you're in a lot of pain, and that's why you did it. So there's a healthy shame that comes along with being dishonest. And we can handle that shame as long as we're compassionate towards ourselves at the same time. Yeah, but why? And this is not an excuse, but why did it? I was in a lot of pain. I didn't know what else to do. And yes, I'm sorry for the way I behaved, but that does not make me a bad person. So healthy shame is connected to things we've done, but not to who we are. But what happens when you say to somebody, you should be ashamed of yourself because you're addicted, because you're doing this? You should be ashamed of yourself. Nobody should be ashamed of their self. Healthy, be ashamed of having lied to my wife. Very healthy, as long as I don't wallow in it. And then as long as I use that shame to induce me to behave in more authentic ways, that's not bad. But of course, then there's the social stigma, which keeps pointing a finger at the most traumatized people in our society and to keep telling them, you should be ashamed of yourselves for the way that you dealt with your pain.
It seems so unrealistic to take a child who's in a difficult situation where they're being abused, traumatized, neglected, and then to blame them for not being able to handle it in some perfect way.
Well, Dr. Bessel van der Kolk, who's a leading trauma expert, has said that 95% of the people in the jails of the United States are traumatized children. Basically, take the most traumatized people, then they behave in certain ways that society considers unacceptable, and then we punish them. And what we're really punishing them for is for having been traumatized.
Right.
Because it's totally predictable. If you take 100 people and you traumatize them, a significant percentage, particularly the most sensitive ones, the ones the most hurt, are going to end up behaving in very dysfunctional ways. But then what are we to do with that? Are we going to punish them for it? Or are we going to say, well, how can we help you deal with your shame and your pain so you don't have to behave in those ways? And I know that, you know, the Kilby Center, and that's the work that you guys do one way, and it's the work that I do. But that has to be the entry point towards helping people is a compassionate understanding of the pain that drove the behavior in the first place.
And to work directly with healing the trauma.
To work with healing the trauma, yeah, and to work with, by the way, so that, I mean, now we can talk about what is trauma, and people think of trauma as being these terrible things that happen to you, and those are traumatic, but they're not the trauma. The trauma is what happens inside of you as a result of those things, and what happens is the shutdown of the self. What happens is a disconnection from the body, a shame about the self. So what happens is a loss of connection to oneself, and a worldview that makes it difficult for you to be in the present moment. So trauma ultimately is disconnection from the self and from the present moment. So that instead of you and I talking right now, as I hope we are, as two adults present to ourselves and how we feel and to one another, if we were playing on some traumatic scenario, we would both be driven, or one of us at least would be driven by some past hurt. And then I wouldn't be present at all. You know, and then it would take a lot of consciousness. And if I was acting that way, it would take a lot of consciousness on your part to stay present and to say, well, Gabor, you seem to be in a lot of pain right now. What's happening for you? You know, how can we reconnect here? That would take a lot of consciousness on your part.
To not be triggered.
Not be triggered.
Myself,
and what happens in life is we trigger one another. We trigger our friends. They trigger us. We trigger our partners, spouses, so on. And then we're not realizing that we're not in the present. Trauma shows up in that disconnect from the self and in that disconnect from the present. And that's what trauma is. And so for that, you don't need tsunamis, and you don't need world wars, and you don't need abuse. Although the more that happens, the more likely you're going to be traumatized.
Right.
But you don't. You can just have parents who just couldn't see you because they couldn't see themselves because they'd been traumatized. It's a trauma, of course. But if we expand our view of addiction from substances to everything that people can use to escape from themselves, that work or internet or video games or food or shopping or sex or gambling or television or anything whatsoever, we can see how we live in a very addicted society because we live in a very traumatized society.
You mentioned ADHD and addiction, and certainly ADHD is on the rise as well. Do you want to talk about that, what you meant by that?
Sure. Well, first of all, the medical view of ADHD is, again, we have a biological disorder of the brain. Like they think addiction is a biological disorder of the brain. And it's not that there aren't biological problems in the brain, but is that the primary issue? So what we know now is that the brain develops an interaction with the environment. So even if you see an adult with disordered brain, the disorder didn't begin with the brain. The disorder was a result of the circumstances that affected their brain development. And trauma affects brain development in unhealthy ways. So to talk about the problem as a biological brain problem primarily is to ignore, again, that biological brain problem developed in response to a certain set of life experiences. Now, if you ask the question about ADHD, so the numbers are going up, the number of kids being medicated is going up all the time. What we cannot be dealing with is a genetic problem, because genes don't change in a population over 10 or 15 or 20 years or 5 years. So the numbers are going up and up. Either we're overdiagnosing, which is entirely possible, which is totally possible, of course. But if we're genuinely seeing more kids with problems, what it cannot be is a genetic issue, because genes don't change rapidly or even over decades or 100 years. What we're dealing with are conditions in which children find themselves tuning out more. Now, what is tuning out? Is it a disease? Why do we have the capacity to tune out? What's your answer to that?
There's something going on that we can't be present with.
Exactly. It's a coping mechanism. You know, if I were to start be abusive towards you right now, just on the screen here, you could tell me to back off, assert yourself. You could switch off the screen and just escape. Or you might look around to see somebody who could help you. But if you couldn't do any of those, one mechanism that your brain might invoke is just to tune out, so you don't suffer so much. That's the situation of a child in a stressed environment. And what I'm saying is that the reason we're seeing so many kids with that particular issue right now, because the environments in which children are being raised are more and more stressed. And I'm not blaming the parents. It's not their individual fault. They're doing their best. But their best is in a society where there's more and more inequality, more and more stress, more and more people having to hold on to jobs, more and more people being depressed and anxious and so on. All those issues on the part of the parents translate into stress on the child, and the child has got a limited number of ways of coping with it. One of them is to tune out. And when that is happening in your early years, when your brain is developing, that's going to have an impact on your brain development. So the reason we're seeing addiction more and more, and we're seeing ADHD more and more, is identical. More and more stress as children are growing up. Now, the link is, of course, that the people with ADHD lack impulse control. That's one of the features of the condition. Who else lacks impulse control?
People with addiction.
People with addiction.
Yeah.
Should big overlap. How do we treat ADHD? We treat it with stimulant medications such as Ritalin or Dexedrine or Adderall, which elevate dopamine levels in the brain so that the person can be more present and more motivated. What else elevates dopamine levels? Crystal meth, cocaine, nicotine, caffeine, or looking forward to doing heroin, or shopping, or searching for that perfect ice cream, or hunting for the next sexual partner. All these things elevate dopamine in the brain, which are attempts just to feel present and motivated. So given that that's the problem with addiction, no wonder that a lot of people with ADHD will try and self-regulate, self-soothe through addictive behaviors, which could be specifically through stimulant drugs, and very often are. Again, caffeine, crystal meth, nicotine, cocaine, or it could be through these highly dopamine-driving behaviors, such as any addiction involves. So of course there's a huge overlap, both in the origin and also in the manifestation of both conditions.
And then the impact of those drugs on a child's brain.
Well, that's another big question, isn't it? We have this huge social experiment now in the chemical management of children's brains. And now they're talking about giving it to 4-year-olds even. And instead of asking what in the environment is making that child hyperactive and tuned out, and how can we change their environment to invite the child to be present and make them feel safe and comfortable and connected. How can we change, in other words, if we create a different environment. See, if you and I are talking to each other, and if I was very tense and distracted and maybe dismissive, that would change your body. Unless you're very present to yourself, it would make your physiology very different. But children's physiology depend very much on the children being so dependent on the adult. And you're not that dependent on me. We have never met. We might never talk again. I hope we do, but we might not.
Mhm.
But there's no big deal if we don't.
Yeah, low risk.
But it's a low risk situation. But even then, if I were to be different emotionally and physiology and in my demeanor, your physiology would shift.
Mm-hmm.
The child's physiology is very much dependent on the environment, particularly the degrees of connection and safety in the environment. So the question is, instead of jumping to medicating kids, how about we consider changing their environments in such a way as to promote healthy physiological change in them? And now, having said that, I'm not 100% against medications either, except they're not the answer. They could be a temporary solution sometimes, right, but they don't change the overall trajectory of the child. So if they need, I'd be very reluctant to use them in younger children especially. But I'd be totally unwilling to use them if they're the only thing we're going to do. Because by themselves, they don't change anything except temporarily, and they don't help the child develop. And so the question is, how do we help children develop? And for that, we have to look at the conditions. And the same thing is true in addiction treatment. How do we want these adults to develop? And if so, what conditions, circumstances, and support can we give them so they can develop in a healthy way?
Well, and adults are often making up for a lack of emotional regulation, things that weren't learned as children, lack of social trust.
Well, let me rephrase that. I agree with you. So that in line with Dr. Stephen Porges' work, addiction is very much a question of self-regulation. So that if I don't have the neurological mechanisms, the neuropsychological, to give an even more difficult word, the neuropsychophysiological mechanisms to regulate myself. When something happens, I get discombobulated. Then addiction is one way to regulate myself. Then to inject or smoke or ingest some heroin or other substance or alcohol, or to turn on a TV set. These are ways of self-regulating.
Right.
The only phrase of yours that I would want to rephrase is, if we didn't learn it, these are not learned behaviors. These are developed behaviors. They emerge from interaction with the environment. It's not that we learn how to regulate ourselves by watching somebody else. It's that if they provide us with an environment where they're so calm and connected with us that we are regulated, then we develop the self-regulation. And when the environment can give us that, we don't develop it. But it's not exactly learning, like learning a language or learning how to play a piano. You know, we can work with kids to teach them self-regulation skills if we've given a very safe environment. And when they're open to that kind of learning, well, then, yeah. Then you can say, oh, when you feel really bad, angry right now, how about taking 5 deep breaths, see what happens for you? You can teach that kind of stuff. But mostly it's not a learned attribute. Mostly it's a developmental attribute that emerges from our relationships with the caregiving adults. And I have to say, in the case of adults who are trying to overcome addiction or heal from trauma, it emerges for them as well, out of safe relationships with nurturing caregivers.
Right. That's an important distinction. Given that we're in this trauma-saturated society and there's so much addiction, what are some things that people could do, individuals or treatment centers, or we talked about creating safety, but what could people do if they're having difficulty right now? What would your suggestions be?
Well, we are, especially if we're addicted, we're terrible at regulating ourselves. So we do have to find an environment that supports us. Mm-hmm. Whatever one thinks of a 12-step groups, and there's all kinds of criticisms that can be made of the movement and of individual groupings in the movement. But when they're working, they provide a place where you can say, here's who I am, and nobody's going to point fingers at you. They'll say, if you really feel there's no judgment there. Sometimes the problem is you go to a 12-step group and you might need a lot of judgment. But the intention is not to judge. The intention is to accept. So I'm only mentioning 12-step groups as one particular modality of a community where you just can't do it on your own. It's very hard to do it on your own. A treatment center, a meditation group, any kind of communal effort where there's mutual acceptance. People have to find others that they can work with. And if you're relegated to having to do this on your own, that doesn't mean it's hopeless. But in the Buddhist tradition, they talk about the three refuges. That they call it the three refuges, which are the Buddha, the Dharma, and the Sangha. The Buddha meaning not the historical teacher, but our Buddha nature, our capacity for presence and wisdom. So that's one refuge you've got. The Dharma is the particular path. In the Buddhist tradition, it's the Eightfold Noble Path. The Noble Eightfold Path. I'm not going to go into it. I'm not a Buddhist teacher or practitioner for that matter. But I'm just giving an example of there's a particular path. So you have to have some trust in your own wisdom and truth, which is what in 12-step groups they call the higher power, or one way to look at the higher power. Then some kind of a path, some program that you're going to follow, because you can't do it in your head. So there's going to be some active steps. And then they talk about the Buddha, the Dharma, that's the path, and the Sangha. And the Sangha is the community. So you're going to have to connect with yourself, believe in yourself, connect with others who are on the same path, and have a path. Right. There are many of them out there, and many treatment programs out there. But those are the essentials. Now, in terms of trauma work, there's what you do, there's what I do. There is emotional freedom technique, EFT. There's EMDR, eye movement desensitization, reprogramming. There is craniosacral work. There is somatic experiencing, the work of Peter Levine. There's all kinds of therapies. There's some even psychedelic modalities of working with trauma. The FDA has just approved a trial of MDMA or ecstasy for trauma work. It's a very promising modality. So you're going to have to find a path. You're going to have to find a community. Other than that, without that, it's very, very difficult. And hopefully you'll find teachers, therapists, and others that, and practices like meditation and yoga, anything that brings you into the present moment. Mm-hmm. And for some people who've been deeply traumatized, sitting still in a cushion when, this is Stephen Porges teaching this again, when you're immobilized as a child because somebody was sexually abusing you, then being still might bring up a lot of fear for you. Then you have to work with that. So it's impossible to give a general prescription, but there are many modalities.
Right. And we'll put up some of those resources to Bessel van der Kolk and Stephen Porges. How can people get a hold of you? I know that there's a lot on the internet.
TEDx talk I gave in Rio de Janeiro, and that's the talk of mine that's been seen most often of my own talks. It's been seen by about 700,000 plus people, and counting. That's okay. Taylor Swift has got a song that's been seen by 2,300,000,000 people. So I'm not up in the big leagues just yet. But many of my talks have been filmed and put on YouTube, not by me, mm-hmm. but just whoever posts them, which also means they're totally free. So there's nobody has to pay anything to see me on YouTube. Yeah. So a lot of my talks on addiction, into use, and so on are available on YouTube. They're also my 4 books, and my website is www.drgabormate.com, where a lot of my lectures can be found, excerpts from my books, into use, information on speaking events, all that stuff. And also, there's a contact page there where people can write me if they want.
Mhm. Okay, excellent. Is there anything that you wanted to say before we finish up?
Oh, I think I'm certain we could talk for another 3 hours. But I think in terms of what I would say about the basis of addiction and trauma and the importance of dealing with that trauma in healing the addictive process, I think we've covered that, at least the basics of it. So no, there's nothing more I would say at the moment.
What about a quote? Do you have a quote that you work with?
A quote that I work with?
Mm-hmm.
I have a million quotes that I work with. I can give you a couple of them if you want.
Yeah, sure. That'd be great.
I carry them on my cell phone.
Oh, that's a good idea.
So I just open up. Oh, my cell phone is a real cornucopia of wisdom. So I'm going to read you a couple of things here. One is from the Tibetan Book of Living and Dying. And this is what they say. Whatever you do, don't shut off your pain. Accept your pain and remain vulnerable. However desperate you become, accept your pain as it is, because it is in fact trying to hand you a precious gift, the chance of discovery through spiritual practice, what lies beyond sorrow. And don't we know only too well that protection from pain doesn't work, and that when we try to defend ourselves from suffering, we only suffer more, and we don't learn more that we can. So in other words, the desperation to escape from our pain perpetuates our pain.
Right.
And that's what addiction does. And as one of my teachers, Alma, says that the surest way of going to hell is to try and avoid going to hell. And but I'll also give you another quote by the same teacher, Almas. He says, the fundamental thing that happened, and I'm paraphrasing, the basic catastrophe is not that there was no love or support in your life as a child. The most fundamental catastrophe is a result of that first catastrophe, which is that you lost the connection to your essence. In other words, the real problem wasn't that your mother or father couldn't support you, or maybe even they hurt you. The problem was that as a result of that, you lost the connection to yourself. That's the good. That's the greatest catastrophe. That's the greatest calamity. He doesn't use catastrophe. Calamity, he says. No, that's the good news. Because if the problem was what happened to you and I, however many decades ago, if that's the problem, we're basically lost, aren't we? Because ain't never gonna not happen, right?
Yeah, yeah.
But if the problem is that as a result of that, we lost the connection to our essence, well, that can be regained at any moment.
Right.
And that's the positive news.
Mm-hmm.
So those are two of the quotes that I go by.
Oh, thank you. Well, thank you very much for meeting with us and being part of the Radical Recovery Summit. It's wonderful to have that chance to talk with you.
It's an honor. Thank you for asking.
Okay, thank you. Go to killibycenter.com, Radical Recovery Summit, to see the full schedule of speakers and to register to watch these free online September 23rd and 24th in the Radical Recovery Summit 2017. Scott Killaby invited Dr. Maté to be part of the live event on Amplifield for the opening of the Radical Recovery Summit. Dr. Maté was unable to attend because of a previous engagement that he had with his son Daniel Maté. Here are the details.
My son and I are doing an event that they actually here in Vancouver on the relationship between adult children and their parents.
Oh, interesting.
Yeah, if you ever want to see that, we gave a talk last year, which is on YouTube. Just Google Daniel and Gabor Maté, and you can see
Okay.
that talk. But we're doing that same workshop again, just that particular day.